Hi, Terry Schoenfeld here for UAB School of Medicine. In this video, I'd like to show you how to locate and use clinical prediction rules in DynaMed. DynaMed is a resource I use regularly. It's a very up-to-date, very evidence-based point of care, what I really call an electronic textbook. They would probably call a point of care resource. And DynaMed is available at dynamed.ebscohost.com, or for you UAB folks, it's at Lister Hill Library under the databases. And when you log into DynaMed, you'll land on this page. And up the top here you can see calculators, and there's a variety of different calculators that are available. If you click on one of them, it'll open another page. In this case, I've opened the medical equations. Now, medical equations are just simple calculations about patients like A gradients, glomerular filtration rates, ideal body weights, some various drug dosing things. You can see there's quite a few of them in here. Really is very comprehensive. We'll have most of the calculators you would ever need in caring for an internal medicine patient. What I largely use this for is the clinical prediction rules. In this case, in DynaMed, they're called clinical criteria. And what clinical prediction rules are tools to estimate pretest probability of disease prior to ordering any diagnostic test. And again, there are quite a few of them available in here. Now, one limitation is that not every clinical prediction rule that's mentioned throughout this entire evidence-based resource is located in their clinical criteria here. There are a few that I regularly use, for example, the Gupta preoperative cardiac risk assessment tool, which for some reason is not available in this clinical criteria area, but is available in the text. And when you click on the calculator inside that text, it will open up the calculator so that you can figure out the patient's pretest probability. All these calculators, wherever they're mentioned throughout the text, will be available in there, and you can click on them when you're reading a chapter and use them. So you don't always have to come to this clinical criteria area. So they are located alphabetically in here. There's a lot of them. And there's even more in the body of the resource, and you can also get to them very quickly by clicking on the alphabet where the particular disease that you're interested in resides. In this case, let's look at the Wells score for pulmonary embolism, and the way it's organized is that the components of the Wells score up here, you just click on the ones that your patient has. It will tally the score, and you compare your score down here to this box to estimate the pretest probability, in this case of a pulmonary embolism, prior to ordering any further tests. As you would expect in a good evidence-based resource, the evidence upon which this calculator is based is referenced here, and if you click on this PubMed icon, you will get a PubMed abstract. Other things that are in here, these decision trees are sort of clicking on criteria that will work your way down a tree to give you a probability. I really don't use those very much. Statistical calculators is really quite an extensive collection of statistical calculators here that you can use when reading a paper to make sense of the numbers or to calculate numbers yourselves. There's even some for calculating things like odds that we don't really think about very much from probability and that we don't remember the formulas for. So really a very good collection of medical equations. They are organized by specialty if you like to find things that way, and there's also a simple math calculator built in for simple calculations. So one of the nice things about DynaMed is it's available on the web, but it's also an app that looks fairly similar to how it looks on the web, and it's available for Android devices and iOS.